why the White House is interested. This is the first, this is a big social experiment, right? The White House is interested because this is the first time that the community's really been sought out for their help and assistance in dealing with mental health problems. So this is a really innovative study. And I feel like I'm proud. You know, we're taking the bulls by the horns here. We're saying that we don't expect additional resources to come our way. So somebody has to take responsibility for trying to create more access to care. So I think, you know, there's a lot of potential. We'll see though. If, you know, we shouldn't. We're talking a lot about the community engagement arm of this study. You know, this is a project. We're going to see if it makes a difference if we're all involved. And, you know, I think we need to remember that it may be difficult for us to step out of our routines. And, of course, I always root for community. I always do. But we're going to see if it makes a difference. So I think that's important to remember. And, you know, what we're trying to do in terms of the last category, increasing the capacity for work. There's some ideas under collaborative care for increasing capacity. Team case review. Wouldn't that be wonderful? To be able to have a group to contact, you know, I would love to talk to a therapist about, you know, is this medicine the right medicine? Can you take medicine and therapy at the same time? What kind of therapy? I mean, I guess there are many kinds of therapy. I'm not a therapist. There are many ways to help someone through a depression. And what's best? So team supervision might be a great way. You know, we're always trying to get access to doctors and the nurses, my nurses are. And so having the ability, may not be a Queen's Care doctor, and to me it doesn't really matter as long as it's a team and everybody brings something special to the table, you know, having that access.
I just wanted to take off from that because BHS has done a couple of different collaborative projects with mental health where we actually, you know, have treatment teams that meet together. They discuss treatment planning. So there's a mental health person, a substance abuse person, working together to develop a treatment plan. It may be a mental health client or it may be a substance abuse client, but we kind of trade information back and forth, and it goes along with what you're saying. What I've been trying to do is get some primary care people involved. That's quite difficult. But, you know, through this project, just imagine, like Elizabeth was saying, is if we could put together, you know, kind of some teams that could sit down and kind of do case presentation and say, you know, what do you think is the best way to handle this, or who could we refer this person to, or that kind of thing. I think it'd be pretty awesome.
Other ways? Questions or comments?
We're doing all the talking.
How could you increase your capacity through collaborative care?
I'm not sure about through collaborative care, but some of the ways that we're already working on increasing our capacity is to move away from individual models of service delivery into more group models, just out of primarily the need to continue to not have huge waiting lists. So, you know, that has its own culture shift with employees and values of what one believes works and what one believes is second-class service delivery and the like. So productivity numbers are embedded in that and the like. But we're sure trying to increase access by having more group formats occurring so that our productivity number isn't hurt because it's simply getting more people in the same hour.
Following with what Elizabeth was saying, and I could direct this to you or anybody in here, though, what is your feeling about collaborating not only with, let's say, with substance abuse or with, you know, the primary care doc down the street, but within a network of folks? I mean, is that something that you see your agency as being capable of doing? Is that too much for you to do? Do you see a value in doing that?
Yeah, we find it absolutely required to keep business flowing. I mean, it's the only way to do business in this century, because otherwise you end up having disgruntled clients, and that falls on you if you don't find them the help they need. So we're really approaching it both from a business venture of customer satisfaction levels as well as directly improving their conditions. So.
Good for you. I was going to say it's really hard to work with other organizations because you have your own mandate of what to do. I'll tell you one thing that we've thought of to facilitate different organizations working together. We've got sample MOUs. We recognize that, for Children's Bureau to work with Queen's Care, you might need some kind of agreement, official agreement. So we have been collecting examples of MOUs, Memorandum of Understanding, to facilitate. So if we did become a partner, that we could, engage in an MOU. DMH right now is examining an MOU with CPIC, and it's actually going before the Board of Supervisors, I think, that they are formally a partner in CPIC, and what are the limitations on that kind of arrangement. So so we recognize there are barriers. We want to work together in an ideal world, but we have our mandates, and we have our clients that need their whatever on a certain day, and so we are going to try and facilitate. We know it's going to be hard, but we think we can do it. So do you want to say something?
Yeah, please. My question is, I definitely see the effort in bringing all these individuals together. I think it's going to make us obviously a little bit more efficient, more effective at treating the patients. Has there been a push to go even a little bit more further and actually having some kind of knowledge, resources available so that we could try and get individuals who are affecting the patients in the same room and the same table talking about how to treat the individuals? Because in my my experience, for example, there's been cases where I'll have the patient, and I'll be talking to somebody else who's providing services, and I'll get information from them, but it takes just too long for me to receive that information. Wouldn't it be better to go ahead and work with these different agencies, come in like maybe once a month and talk about, hey, this is what I'm doing, how can we better assist this client? Is there something that in the works, or is it too much of a risk at this point, or what are some of the things that we...
You need to come to the community engagement meeting.
Present that idea. I mean, that's the kind of idea that we hope somebody from the community would put forward and say, why don't we work on this kind of idea? The sky's the limit. The community plan is the community plan. There's no set limit. I mean, we don't know what's going to result. But it's good ideas like that will make a difference. So, it's hard enough to get people to the table. We're so happy we got this many people to come today to the table. So our next challenge will be creating a plan that makes a difference.
And one of the things we've kind of been struggling with, because it seems as though people want to be told what to do. Well, tell us, what do we need to do? What are we going to do? And the whole purpose of this is to bring folks together to say, this is what we want to do. So ideas like yours, we're hoping that's going to rise to the surface out of the community engagement process meetings, that somebody like you says, well, I think we'd be more effective if we had case presentations, in our mutual clients or whatever. I mean, whatever it is that would make it more effective for all of us. And that's where I see some of these resources really coming together and people starting to think out of the box a little bit about what can happen. But it's you folks. It's not going to be me or Elizabeth or Ken or anybody else or Loretta. And in fact, it's just the opposite. They're standing back saying, okay, we brought you all together. Let's hear what you have to say. So that's what this is about, is really hopefully getting all the members of the community together and let them decide what's the best thing, what's the most effective thing that's going to work in our community. And to me, that's probably one of the most exciting parts of this whole thing.